If you're over 60 and your knees hurt when you stand up, if you feel a little dizzy when you walk, or if your balance isn't what it used to be, stop scrolling. What if I told you that one simple wall exercise, done for just 1 minute a day, could help reduce knee pain, improve your balance, and even decrease that lightheaded feeling many seniors struggle with? And the best part, you don't need equipment. You don't need to get on the floor. You just need a wall. Before we begin, if you care about staying strong, steady, and independent after 60, take a second to like this video and subscribe to Human Health Explained. We share simple science-based tips that help you move better and feel safer every day. Now let's talk about why this 1-minute wall exercise is so powerful. As we age, 3 things quietly start to decline. First, our leg muscles, especially the quadriceps and glutes, get weaker. Second, our balance system becomes less responsive. And third, blood circulation in the lower body slows down. These changes don't happen overnight. They build up slowly. That's why many people don't notice until they feel knee pain climbing stairs, or they need to hold on to furniture while walking, or they feel slightly dizzy when they stand up. Here's what most people don't realize. Knee pain is not always just about the knee. Very often, it's about weak thigh muscles that are no longer supporting the joint. Poor balance isn't always about the inner ear. It's often about weak hips and legs that can't stabilize your body. And dizziness. Sometimes it's linked to poor circulation and weak muscle pumping action in the legs. Now imagine activating all of those systems at the same time. That's exactly what this wall exercise does. It's often called a wall sit or a supported horse stance hold. But don't worry, we're not talking about anything extreme. This is a safe, modified version designed especially for adults over 60. Let me explain how it works. When you lean your back against the wall and gently bend your knees, your thigh muscles switch on immediately. Your quadriceps begin to support your knees. Your glutes stabilize your hips. Your calves help with circulation. Even your core muscles engage to keep you upright, and because you're holding a steady position, your nervous system is forced to improve balance control. All of this happens in one simple posture. Here's how to do it safely. Stand with your back flat against a wall. Your feet should be about shoulder width apart and about 1 to 1.5 feet away from the wall. Slowly slide your back down the wall until your knees bend slightly. You do not need to go into a deep squat. Even a small bend is enough to activate the muscles. Keep your chest up, your head relaxed against the wall, and your weight evenly distributed between both feet. Now hold that position. At first, aim for 20 seconds. If you feel comfortable, slowly build up to 30 seconds. Eventually, work toward 60 seconds. You should feel your thighs working, but you should not feel sharp pain in your knees. If you do, come up slightly or stop. So, how does this help knee pain? Strong quadriceps act like shock absorbers. They reduced the stress placed directly on the knee joint. Over time, stronger muscles mean less strain with every step. Many seniors notice that stairs become easier and standing up from a chair feels smoother after just a few weeks of consistent practice. Now, let's talk about balance. When you hold this position, Your body constantly makes tiny adjustments to keep you stable. Those small corrections train your balance system. It's like a quiet workout for your stability muscles. Improved leg strength plus improved balance reactions means a lower risk of falls. And that's huge after 60. What about dizziness? When you contract your leg muscles, they act like a pump. They push blood back toward your heart. Better circulation can reduce that lightheaded feeling when standing up. Of course, if you have medical conditions causing dizziness, you should always speak with your doctor. But for many people, weak muscles and poor circulation are part of the problem. Here's something important. Consistency matters more than intensity. You don't need to hold this for 5 minutes. You don't need to feel extreme discomfort. One focused minute every day is enough to create change over time. Think of it like brushing your teeth. Small daily habits protect you long term. I once spoke with a 68-year-old woman who said her knees felt stiff every morning. She started doing this wall exercise while waiting for her coffee to brew. Just 30 to 45 seconds. After 3 weeks, she noticed she wasn't grabbing the railing as tightly when going downstairs. That's the power of small daily activation. If 1 minute feels too easy, you can gently progress. You can hold light dumbbells. You can add a small cushion between your knees and gently squeeze it to activate your inner thighs. Or you can perform 2 sets instead of 1. But always prioritize form and safety. Let's also talk about posture. Many older adults lean forward when standing. The wall supports your spine and encourage upright alignment. That upright posture improves breathing, confidence, and stability. Now, a quick safety reminder: if you have severe arthritis, recent knee surgery, uncontrolled blood pressure, or serious balance disorders, consult a healthcare professional before trying new exercises, and always have a sturdy chair nearby in case you need support. Another powerful benefit is confidence. Fear of falling is common after 60, and fear itself can limit movement. When your legs feel stronger, your confidence improves. When your confidence improves, you move more, and when you move more, your health improves. It becomes a positive cycle instead of a negative one. Let's break it down simply. Stronger thighs protect your knees. Stronger hips improve balance. Active calf muscles improve circulation. One position trains all 3. That's efficiency. You might be wondering, how long before I see results? Most people begin to feel subtle improvements in 2 to 3 weeks. More noticeable strength gains often appear around 4 to 6 weeks. Remember, muscles adapt with regular stimulus, and here's something encouraging. Even in your 70s or 80s, your muscles can grow stronger. Age does not cancel your body's ability to adapt. It only changes the speed. Patience and consistency win. Try pairing this exercise with a daily routine. After brushing your teeth while watching the evening news, before dinner, attach it to something you already do. That makes it easier to stick with. Breathing is also important. Do not hold your breath. Inhale slowly through your nose. Exhale gently through your mouth. Calm breathing reduces unnecessary tension and prevents spikes in blood pressure. If your knees feel uncomfortable at first, reduce the bend. Even a small slide down the wall activates the muscles. Progress. Gradually, your body responds best to gentle, steady improvement. Think about where you want to be in 5 years. Walking confidently, climbing stairs without hesitation, standing up without pushing off the chair. Small habits today shape that future. At Human Health Explained, we believe aging should mean gaining wisdom, not losing mobility. Your body still listens to what you ask of it. The question is, are you giving it the right signals? 1 minute. That's all it takes to send a powerful signal to your muscles, your joints, and your balance system. Before we finish, I want you to imagine something. Imagine standing up tomorrow morning and feeling just a little steadier. Imagine walking into the grocery store without scanning for something to hold on to. Imagine trusting your legs again. That trust begins with small actions. Start today. Stand against a wall. Slide down slightly. Hold. Breathe. Count to 20. And tomorrow, do it again. If you found this helpful, comment below with the word strong so we know you're recommitted to building stronger legs. Share this video with a friend or family member over 60 who could benefit from better balance and less knee pain. And if you haven't already, make sure you're subscribed to Human Health Explained for more simple, practical health strategies designed to keep you active and independent. Your future strength starts with 1 minute today.